Hello and welcome. Today we're diving deep into the world of aortic aneurysms, specifically focusing on those occurring in the thoracic and abdominal regions. An aortic aneurysm is a silent threat, a bulge in the aorta, the body's largest artery, that can have devastating consequences if left undetected and untreated. Join us as we explore the causes, symptoms, diagnosis, treatment, and prevention of this potentially life-threatening condition. What causes these aneurysms to form? The etiology of aortic aneurysms is often multifactorial. Atherosclerosis, the buildup of plaque in the arteries, is a major culprit, weakening the aortic wall over time. Other significant contributors include high blood pressure, genetic predispositions like Marfan syndrome and Ehlers-Danlos syndrome which affect connective tissue, and a history of smoking. Trauma, infections, and inflammatory conditions can also play a role in the development of aortic aneurysms. Let's talk pathophysiology. An aortic aneurysm develops when the walls of the aorta weaken. This weakening can be due to the destruction of collagen and elastin, the key structural proteins in the aortic wall. As blood pressure pushes against this weakened area, the aorta begins to bulge outwards, forming an aneurysm. This bulging can progressively enlarge, increasing the risk of rupture or dissection, where the layers of the aorta separate. A rupture results in severe internal bleeding and is a medical emergency. Dissection can disrupt blood flow to vital organs. How common are aortic aneurysms? Epidemiology reveals that aortic aneurysms are more prevalent in older adults, particularly men. Abdominal aortic aneurysms are significantly more common than thoracic aortic aneurysms. Risk factors like smoking, high blood pressure, and a family history of aneurysms contribute to the incidence of this condition. While exact numbers vary depending on the population studied, it's estimated that a significant percentage of the population over 60 may have an undiagnosed aortic aneurysm. Now, what are the signs and symptoms? Unfortunately, aortic aneurysms are often asymptomatic, especially in the early stages. This is why they're sometimes referred to as silent killers. However, as an aneurysm grows, it may press on surrounding structures, leading to symptoms. Thoracic aortic aneurysms can cause chest pain, back pain, hoarseness, coughing, or shortness of breath. Abdominal aortic aneurysms may cause a deep, throbbing pain in the abdomen or back, or a pulsating sensation in the abdomen. A sudden, severe pain could indicate an impending or actual rupture, which requires immediate medical attention. How are aortic aneurysms diagnosed? Diagnosis typically involves imaging techniques. An ultrasound is often used for initial screening, particularly for abdominal aortic aneurysms. CT scans and MRI scans provide more detailed images of the aorta, allowing doctors to accurately measure the size and location of the aneurysm. Angiography, which involves injecting a contrast dye into the blood vessels, can also be used to visualize the aorta and identify any abnormalities. Regular screening is recommended for individuals with risk factors, especially those with a family history of aneurysms. Aortic aneurysms are broadly classified based on their location. A thoracic aortic aneurysm occurs in the chest area, while an abdominal aortic aneurysm occurs in the abdomen, below the diaphragm. They can be further classified by their shape: fusiform, which is spindle-shaped, or saccular, which is a pouch-like bulge, and whether they involve the ascending aorta, aortic arch, or descending aorta in the chest, or the infrarenal or supranal aorta in the abdomen. Knowing the specific location and type is crucial for determining the appropriate treatment strategy. What are the treatment and management options? Treatment depends on the size, location, and growth rate of the aneurysm, as well as the patient's overall health. Small aneurysms may be managed with watchful waiting, involving regular monitoring with imaging studies. Medications, such as beta blockers and ACE inhibitors, may be prescribed to control blood pressure and reduce the stress on the aortic wall. Larger aneurysms, or those that are rapidly growing, typically require surgical intervention. This can involve open surgical repair, where the damaged section of the aorta is replaced with a graft, or endovascular aneurysm repair (EVAR), a minimally invasive procedure where a stent graft is inserted into the aorta to reinforce the weakened area. The choice between these procedures depends on several factors, including the patient's anatomy and overall health. Can aortic aneurysms be prevented? While not all aortic aneurysms can be prevented, there are several steps you can take to reduce your risk. Quitting smoking is crucial, as smoking significantly increases the risk of aneurysm development and rupture. Managing high blood pressure through medication and lifestyle changes is also essential. Maintaining a healthy weight, eating a balanced diet, and engaging in regular exercise can contribute to overall cardiovascular health. If you have a family history of aortic aneurysms, talk to your doctor about screening recommendations. What is the prognosis for individuals with aortic aneurysms? The prognosis depends on the size and location of the aneurysm, the patient's overall health, and the timeliness of diagnosis and treatment. Untreated aortic aneurysms carry a significant risk of rupture, which is often fatal. However, with early detection and appropriate management, including surgical repair when necessary, the prognosis can be significantly improved. Research continues to advance our understanding of aortic aneurysms, leading to the development of new and improved treatment options. For example, ongoing studies are investigating the use of gene therapy and other novel approaches to strengthen the aortic wall and prevent aneurysm formation. Continued vigilance and advancements in medical technology offer hope for better outcomes for individuals at risk for or living with aortic aneurysms.